Center Test Prep Exam Answers 2023. Question 1. A patient with known cirrhosis presents with massive hematemesis. The nurse suspects bleeding from Option A. Peptic ulcer. Option B. Esophageal varices. Option C. Hemorrhoids. Option D. Malloy-Weiss tear. The correct answer is Option B. Esophageal varices. In a patient with cirrhosis and portal hypertension, massive, painless hematemesis is most likely from ruptured esophageal varices, a life-threatening emergency. Question 2. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. Synchronized cardioversion at 100 J. Option C. Immediate high-quality CPR and defibrillation. Option D. Transcutaneous pacing. The correct answer is Option C. Immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 3. CIRS, Systemic Inflammatory Response Syndrome. Criteria include all of the following except Option A. Heart rate 90 bpm. Option B. Respiratory rate 20 or PaCO2 32 mm Hg. Option C. Temperature 38 degrees C or 36 degrees Celsius. Option D. Elevated troponin. The correct answer is Option D. Elevated troponin. CIRS criteria include abnormalities in temperature, heart rate, respiratory rate, and white blood cell count. Elevated troponin is not a CIRS criterion. It indicates myocardial injury. Question 4. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A. Encourage early ambulation. Option B. Keep the patient NPO and provide aggressive for fluid resuscitation. Option C. Administer high-fat diet. Option D. Restrict all 4 fluids. The correct answer is Option B. Keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 5. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A. Patients with private insurance only. Option B. Any person who comes to the ED and requests care. Option C. US citizens only. Option D. Patients with urgent conditions only. The correct answer is Option B. Any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 6. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes Option A. Hypertension, bradycardia, headache. Option B. Abdominal pain, hypotension, and a pulsatile mass. Option C. Fever, chills, flank pain. Option D. Dysuria, frequency, urgency. The correct answer is Option B. Abdominal pain, hypotension, and a pulsatile mass. The classic triad is abdominal or back pain, hypotension, and a palpable pulsatile abdominal mass. However, the triad is present in only a minority of patients. Question 7. Carbon monoxide poisoning leads to hypoxia primarily by Option A. Causing bronchospasm. Option B. Binding to hemoglobin with higher affinity than oxygen. Option C. Destroying lung parenchyma. Option D. Causing pulmonary edema. The correct answer is Option B. Binding to hemoglobin with higher affinity than oxygen. Carbon monoxide has an affinity for hemoglobin 200 to 250 times greater than oxygen. By binding to hemoglobin, it forms carboxyhemoglobin, reducing the blood's oxygen carrying capacity. Question 8. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG change is the patient most at risk for? Option A, atrial flutter. Option B, prolonged QT interval. Option C, Osborne, J, wave. Option D, ST depression. The correct answer is option C, Osborne, J, wave. The Osborne or J wave, a positive deflection at the J point, is a characteristic ECG finding in moderate to severe hypothermia and becomes more pronounced as temperature decreases. Question 9. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is: option A, absent breath sounds. Option B, dullness to percussion on the affected side. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. With hemothorax, blood in the pleural space, percussion produces dullness due to fluid. In pneumothorax produces hyperresonance due to air. Both cause decreased breath sounds. Question 10. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, surgery on the wrong body part. Option D, an armor discharge. The correct answer is option C, surgery on the wrong body part. Sentinel events are serious, unexpected occurrences involving death or serious physical or psychological injury, or the risk thereof. Wrong site surgery is a classic example that requires root cause analysis and reporting. Question 11. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Beck's triad consists of hypotension, from decreased cardiac output, muffled heart sounds, from fluid in the pericardial sac, and jugular venous distension, from impaired venous return. Question 12. A female patient of childbearing age with abdominal pain should always be evaluated for: option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered. Question 13. Necrotizing fasciitis requires what priority treatment? Option A, broad-spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Necrotizing fasciitis is a rapidly progressive soft tissue infection requiring aggressive, emergent surgical debridement of all necrotic tissue. Antibiotics alone are insufficient. Question 14. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is: option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Current guidelines recommend an initial bolus of at least 30 ml/kg of 4-isotonic crystalloid solution, for example, normal saline or lactated ringers, for patients with sepsis-induced hypoperfusion or septic shock. Question 15. The safe harbor provision for nurses typically refers to: option A law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, A hospital policy allowing nurses to refuse any assignment. Option D. The requirement to report all medication errors. The correct answer is option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation. Question 16. The purpose of administering surfactant to a patient with ARDS is to: Option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Surfactant reduces surface tension in the alveoli, preventing alveolar collapse, atelectasis, and improving gas exchange in conditions like ARDS. Question 17. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is: Option A. Diltiazem. Option B. Verapamil. Option C. Metoprolol. Option D. Digoxin. The correct answer is option D. Digoxin. Digoxin can be used for rate control in atrial fibrillation, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers, diltiazem, verapamil, are typically avoided in FREEF due to their negative inotropic effects. Beta blockers may be used, but digoxin is often preferred as an adjunct or alternative. Question 18. Which pupil finding is associated with uncal herniation? Option A. Pinpoint, non-reactive pupils. Option B. A unilaterally dilated and fixed pupil. Option C. Bilateral mid-position and fixed pupils. Option D. Constricted, sluggishly reactive pupils. The correct answer is option B. A unilaterally dilated and fixed pupil. As the uncus hernates through the tentorial notch, it compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed, blown pupil. Question 19. In the Emergency Severity Index, ESI, 5-level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: Option A. ESI level 1. Option B. ESI level 2. Option C. ESI level 3. Option D. ESI level 4. The correct answer is option A. ESI level 1. ESI level 1 criteria require immediate, life-saving intervention. An altered mental status with severe respiratory depression requires immediate intervention, making this a level 1, most acute. Question 20. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block. Option C. Maintain airway and administer benzodiazepines as ordered. Option D. Obtain a stat CT scan. The correct answer is option C. Maintain airway and administer benzodiazepines as ordered. The priorities during an active seizure are airway management, positioning, suctioning, oxygenation, and pharmacological termination with a benzodiazepine, for example, lorazepam. Restraints and bite blocks can cause injury. Question 21. A patient with a Lefort 3 fracture is at highest risk for: Option A. Dental malocclusion. Option B. Airway compromise. Option C. Corneal abrasion. Option D. Temporomandibular joint dysfunction. The correct answer is option B. Airway compromise. A Lefort 3 fracture, craniofacial disjunction, can cause posterior displacement of the maxilla and soft palate, which can obstruct the airway, making airway assessment the highest priority. Question 22. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: Option A. Damage above the midbrain. Option B. Damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Decerebrate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 23. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A. No tetanus prophylaxis needed. Option B. Tetanus immunoglobulin only. Option C. TUTOR or TD booster. Option D. Tetanus toxoid and tetanus immunoglobulin. The correct answer is option C. TUTOR or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose, a TUTOR or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 24. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A. Abdominal X-ray. Option B. Abdominal ultrasound. Option C. CT scan of the abdomen. Option D. Complete blood count. The correct answer is option C. CT scan of the abdomen. CT scan of the abdomen with full contrast is the most accurate imaging modality for diagnosing appendicitis, though ultrasound is often the initial test in children and pregnant patients. Question 25. The hallmark sign of compartment syndrome is: Option A. Pain relieved by elevation. Option B. Pain out of proportion to the injury. Option C. Absent pulse in the affected extremity. Option D. Pitting edema. The correct answer is option B. Pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding.